Well, the most important thing as a surgeon, I find that spinal cord stimulation is something that's going to be a big change in the future in patients who have incomplete paraplegia. So bladder stimulation again is something intrathecal baclofen pumps, and these are very useful in patients with severe spasticity, which helps and aids with rehabilitation. Selective dorsal rhizotomy, dress lesionings, and these are all various procedures that help patients recover quickly from spasticity, from pain, and various other procedures. Now, just looking at a little bit of the future. So this is from the surgical point of view. What I've said are things that you can see that they are improving. But the future is much more. So the technology has actually played a major role in rehabilitation. And if you look at it in the 1950s until about the 70s, we were more traditional rehabilitation. Then we introduced biofeedback systems and computer-based systems. And in the 2000s, we've got robotics, and 2010s we have wearable devices. And now we are talking about AI, VR, and AR, and so many other technology that's really coming up. The speakers here today are really excellent in this, and they will be delivering you talks. But I'm just giving you an overview of what's available, the various robotic assisted, virtual reality, wearable technology, gamification, tele-rehab, brain-computer interface. So all of these things are going to revolutionize both pediatric as well as adult rehabilitation. And you have the functional electrical stimulation combined with various other treatments which are going to be spoken about today. We have the freehand systems with the functional electrical stimulation. Exoskeletals, we have a speaker who's going to talk about how exoskeletals are going to help in spinal cord injury rehabilitation, the different types of exoskeletals. Robotic gait training. There are many systems available now, both for upper limbs and for lower limb. The wheelchair technology has also significantly got better with standing wheelchairs and various other things. And for people with quadriplegia, you have the environmental control units, software-based units, and all types of robotic rehab. The technology is advancing so very fast that every year when I go to rehab conferences internationally or to industry, it is just dramatically changing. Neuromodulation techniques again are going to be a big change, game changer in the future, with the brain-computer interface, neural prosthesis, neural rehabilitation, and it was in the trial phase for more than a decade, but now these things are going to be more into practical. And as I said, for the epidural stimulators, the systems are significantly changing the various electrodes, types of electrodes, the batteries, the connections are all improving. And also DBS is now playing a role in spinal stimulation. There is a lot of trials going on about deep brain stimulation. So end of the day, it is a teamwork. It is not just a doctor-led service. It is a surgeon, the therapist who are so advanced now, and their understanding of rehab and technology has improved. And the technology for the right patient, when we combine this, then you can really have some amazing things. I thank you for this opportunity, and